In my practice, hip arthroscopy is generally an operation which I reserve for somewhat younger patients. They often have abnormalities of their hip or deformities, and some, of course, have injuries as well. The typical deformities are abnormalities of bone, usually on the femur or the ball side of the hip joint, but people could have excessive bone on the socket part of the hip as well. There can also be tears of the cartilage, which require repair. And occasionally I've seen patients with loose bodies within their hip joint, which have required removal. But generally it is an operation that is reserved for younger patients, mainly because older patients tend at that stage to have full-blown arthritis. And at that stage, a hip arthroscopy is less likely to be successful. So most patients will be referred for some form of physiotherapy, usually before they've had have a hip arthroscopy. And this is obviously to improve muscle strength around the hip, which would help in the post-operative rehabilitation, and also encourage patients to try and maintain a range of motion as much as possible. Obviously, we don't want patients getting too heavy, because that will make the operation technically much more difficult to perform. And I'd also suggest that patients are fully informed by their surgeon about the risks of the surgery and what to expect prior to going ahead with the surgery. So most patients who have a hip arthroscopy have a general anesthetic, that is to say they are fully asleep, anesthetized. The muscles have to be fully relaxed during the course of the operation, and that is the role of the anesthetist, and it's something I mention to them constantly. Patients are put on a special operating table, which is a table which is able to apply traction or distraction to the legs and to the hip joint. The patient is prepped appropriately, so it's a sterile field, and the wounds that we make are usually small 1 centimeter wounds on the side of the leg, and with very narrow cameras and instruments, where we can put the instruments into the hip joint with the gap that's been created by the distraction from the special table. With those instruments, we can make changes to the inside of the joint. We can repair cartilage, and we can remove bone from areas where we don't want bone to be. And obviously, if there are loose bodies, then we can remove those as well. But it's generally speaking an operation that can take a variable amount of time. It can take a very short period of time. It can take no more than half an hour, but it also can be a lengthy operation, can take up to 2.5 hours. Yeah. It's not, generally speaking, a very painful procedure. The anaesthetists are very good at prescribing appropriate pain relieving medications, and I inject a lot of local anaesthetic in and around the hip joint at the end of the procedure to try and keep that pain under control. Patients are encouraged to use regular painkillers in the post-operative period for the first week or two to keep things under control, so that they can get on with their rehabilitation. There's not usually any lasting side effects. Obviously, a patient could get a complication of the surgery, which may produce a lasting side effect. The only situation where I'd say there may be a lasting side effect would be if the pathology or the problem within the hip joint at the time of the surgery was too severe for the surgeon to correct in some way. Obviously, that would mean that the the process within the joint would continue and become worse over time, and the hip arthroscopy would not have been as successful as one would have liked.